Everyone set up? Great. Well, good morning, Queensland. It's another great day of COVID results. We have no new cases. That's 0 cases for another day here in Queensland, leaving our total number of cases throughout the pandemic at 1,964. Just 39 of those remain active after 12 were discharged. We continue to see a high level of testing given that low amount of COVID in the community. So we did 9,918 samples in the last 24 hours, which is a great result. And Queensland Health continues to ramp up our vaccination efforts. 13,036 vaccines administered by Queensland Health. We now have over 3 million vaccines administered in Queensland since the vaccine became available. We're now down to just 970 people in home quarantine. That's down from a peak of more than 19,000 during the Indooroopilly Delta outbreak. Our QR code app has been incredibly successful and has greatly assisted our contact tracers in their efforts to identify people who may have been in contact with COVID-19. It has worked where other attempts to have a COVID tracing app have failed. As at 4 p.m. on the 18th of August, over 184,000 locations or businesses had a QR code that could talk to the app, and that's growing at a rate of 3% per week. More than 3 million times someone in Queensland has scanned a QR code to check in at a location or business. Approximately 4.68 million devices have downloaded the Check In Queensland app that our contact tracers use to identify who has been at contact locations. And what we're announcing today is a further expansion of the use of the QR code app. From Monday the 30th, so in a week's time, 20,000 taxis, limousines and rideshare vehicles will be required to have the QR code app, and riders will be required to scan the app before they ride. We saw in Cairns just how risky a infected taxi driver could be. We were very fortunate in Cairns not to see further transmission from that case. And so adding the QR codes to rideshare, taxi and limousine vehicles will allow us to ensure that if in the future we have a COVID case in one of those vehicles, we will be able to trace those who may have been in contact with it. And so from here, we're looking to those operators to register, to get their QR code, to begin displaying it on their vehicles, and they will be mandatory from the 30th. The turnaround time on registering is very quick right now. There's just 18 applications currently in the queue, currently pending. And so if people start registering now, we can make sure there's no delays on the day that that goes live. I've also been advised from police that our new, stricter, harsher border measures with New South Wales are working, and we are seeing a dramatic reduction in the number of vehicles crossing the border. Up to 4 p.m. yesterday, we intercepted 2,715 vehicles. 142 of those were turned away. 12 of those were essential workers who would have been admitted if they had have been vaccinated. So that's that new measure coming into effect, where even essential workers aren't guaranteed an exemption to cross. They have to have had at least one vaccination. We're joined today by our Deputy Chief Health Officer, Dr. James Smith. So I'll ask him to say a few words, and then Minister Bailey can talk about the new QR code for transport.
Thank you very much, Deputy Premier. Well, I guess we've heard some encouraging figures this morning. Things are looking good here in Queensland, but we are continuing to watch what's happening in other states, and in particular in New South Wales. We are aware of cases that have occurred in regional New South Wales close to the border. So there is a lot of work going on in places like Darling Downs and southwest Queensland to improve vaccination access. So there's pop-up clinics in places like Gundawindi Hospital and Inglewood Sports Ground. So there's a lot of work going on there to prepare for any incursions from northern New South Wales into Queensland. You'll be aware also that there's been some relaxation of mask rules recently, but we do ask that people continue to wear masks wherever possible, particularly inside. Masks are very effective at reducing the spread of coronavirus. Lastly, as someone who's recently come from working in a public health unit, I'm very pleased to hear about the introduction of the QR codes for taxis. As we learnt from our recent experience in Cairns, that would have been hugely helpful and made the contact tracing process much more efficient up there. So that's some very welcome news. Thanks very much.
Yeah, look, with the situation in New South Wales worsening, to be frank, we're tightening up measures on the border, but we're also making sure that we are as fast and efficient as we can be when it comes to the contact tracing system. So these QR codes are being implemented from Monday week, so the 30th of August, and so I urge all taxi, rideshare and limo operators to get online and register and make sure they're ready to go on that Monday morning, because if we have another outbreak, we want to be able to contact trace as quickly and as efficiently as possible, so that we can make sure our health response is as good as it can be. This is about speed and efficiency, and I thank the taxi, rideshare and limo industry for working with us on this. It was raised with the government a number of weeks ago, and we've been working behind the scenes to get all the technical side to it in place. And so thanks to the companies and the peak bodies. Can I also just say a big thank you to all of our taxi, rideshare and limo drivers out there. I can't recall getting into a taxi or a rideshare in the last 18 months where there hasn't been a driver masked who has, is implementing their own measures. And this is another measure so that if we do get an outbreak, we can contact trace. We work closely with taxi and rideshare companies already with their data, but with this QR code system, we'll be able to do it a lot quicker and a lot more efficiently. So if you're in a taxi or a rideshare from Monday week, the 30th of August, you'll be expected to QR code just like you do in a shopping centre or somewhere that you're entering as per normal, and each passenger will need to do that. Taxi drivers will and rideshare drivers no doubt will remind people to do that, but what we're finding is that both drivers, operators and passengers are actually expecting it and want this to happen. So I urge all the drivers to get online and to register, line it up. They'll need a QR code in the front and the rear so that passengers getting in whichever door can register, but this is another measure in which we're moving to ensure that our health response continues to be world leading here in Queensland. Blair Davies is here from the Taxi Council who want to say a few words, and thanks to Blair and the industry for working so well with us. Blair.
Thank you, Mark, and good morning. The taxi industry welcomes this initiative by the government. It's something we've been calling for a number of weeks now. We believe it will make our cab drivers safer, but also limo drivers and rideshare drivers, and it will also be safer for the community that uses taxis, limos and rideshare. From our point of view, we look at it as just part of the contribution that we can make to keeping Queensland safe, to avoiding lockdowns. They devastate communities, they have a very bad effect on our customers, and of course that's bad for our business. So this is one of the things we can do. As the Minister was saying, we've been very proactive ever since the outbreak of COVID, making sure that we had our vehicles being sanitised, and so we just see this as yet one more thing that we can do. And just lastly in that, we know it can be an inconvenience to customers to have to scan in. Our drivers will assist any passengers that don't have smartphones to be able to do that for themselves. And we would just ask any passengers that are out there late at night, maybe 3 a.m. in the morning, had a night on the town, this is going to be mandated from the 30th of this month. So please just do it and we'll all keep Queensland safe. Thank you. Yes, we think it's about 30%, 35% at the moment. Compared to pre-COVID, it's about 80% of where it was. Oh, so we went down to somewhere like 20% of demand right in the peak of COVID. The rideshare community report that they were down by 90%. Both rideshare and the taxi industry have rebounded, and we think that we're both around 80% of where we were pre-COVID. We're now encouraging drivers to come back in, drive cabs, certainly get vaccinated. And these sorts of measures like the QR code will make driving cabs safer for drivers.
My question was, do any of your taxi drivers have concerns about having the QR code?
Oh, look, no doubt we've got some drivers out there who will be concerned about the customer resistance to scanning in. But this is one of the things that we do. And it's just part of living in this new post-pandemic world. We're going to work through with the government just what to do in that circumstance. A little bit like the retailers, how they comply with the requirements. Certainly, what we'd like to do is encourage all taxi customers. Please just scan in, make it easy for yourself, make it easy for the driver. Yes, we've been very pleased with that. We've been encouraging drivers and customers to mask up when they get into a cab as a voluntary thing. And during the various COVID restrictions that we saw in Queensland where it became mandatory, we saw everybody doing it. We think it's a smart thing for people to do. And even when it no longer becomes mandatory in South East Queensland to mask up, we'd encourage people to still do so. Look, it might be a bit different for some of the other sectors in the personalised transport area, but for cab drivers, look, we've got security cameras there to record everything that gets said and done. If you recall what happened in Cairns, once the cabbie was alerted that they had transported somebody who was COVID positive, we were able then to find all of the passengers that cab had taken. The average cab, we have GPS records of where they went for the last 7 years. So being able to track customers who get into a cab was never the problem. What the QR code will do, it will make it faster for the contact tracers to be able to identify the cab, and they will have at their fingertips all of the people that got into that cab. So this is about streamlining the contact tracing process, making it faster, making it better. And the faster the contact tracers can get to everybody who's come into contact, then the better they're placed to avert community transmission.
Mark, you mentioned that it was mandated for people to often have Look, we don't expect this to be a significant problem. People are very used to the QR codes. It is a normal part of life in the pandemic. And so obviously we ask people for their own protection to do this. So we don't expect this to be a significant problem. Of course, there'll be some people occasionally who don't have a phone with them. There's a system where they can leave their details and then the cabbie can put it into the system for them. I expect that'll be pretty rare, but I think people are used to this issue. So look, we'll see how it goes. We'll be monitoring it. We want to see our cab drivers and our rideshare drivers safe. But we don't expect this to be a significant problem. People are really used to these QR codes.
On the flip side, do you expect drivers to be fine if they repeat to put these QR codes on the cab? We saw a bus driver earlier this week who didn't use COVID.
Look, I think when you look at the drivers in the taxi, rideshare and limo industries, they understand this issue really well. They want to be protected themselves. They want to see their passengers protected as well. And look, this is in everybody's self-interest and in terms of their own health, because what the QR codes do is they identify if you're at risk of getting COVID. And of course, nobody wants to get COVID. So, you know, I think when if there's any resistance from a particular passenger, I think a friendly chat with the driver usually should resolve the situation. Well, look, that'll be a matter for the taxi and rideshare companies, but I think that the drivers understand, I think, that when they're working in a confined space, that it's in their own interest to be complying with company policy and with the health directives. And I can't recall getting into a rideshare or a taxi in the last 18 months where the driver didn't have a mask on, because I think the drivers understand that they need to be protected every day in their workplace. Look, it's not something that's been identified as a significant risk. There's been no real issues of community transmission identified at this point. And of course, with the patronage down about 30% on public transport generally, there's a lot more social distancing than pre-pandemic. So, there's been heightened cleaning, for instance, on our train system. We've got constant reminders of people about what health measures that are there, just reminding them to be safe. Our staff have been magnificent on all our train stations, and our drivers as well on our buses. So we don't expect that that's been identified by health as a significant issue. If it was, of course, we would look at it. Yeah, look, I'm very concerned about the number of lives lost this year. We're up about 17 over last year, and last year wasn't a good year. We had the best year ever in 2019, and I think with the impact of the pandemic, I think there's been some correlation between the anxiety and difficulties of the general situation that are playing out with people making poor decisions on the roads. But what I would say to people is there's a range of tough measures coming in that they should be aware of to crack down on risky behaviour. So, the mobile phone and seatbelt cameras will catch you. They'll be all over the state. They're out there right now. We're bringing in school speed zone speed cameras so that get people speeding past our school kids and our parents. We're toughening up the alcohol interlock measures to target mid-range drink driving from September. So there's going to be a range of measures. So I just say to people, make safety your priority every single time you drive. Not one single person who died on the roads this year thought that would happen. So it can happen to you. So make sure before you start the car, everything is safe.
I think it's pretty incredible to see that while the country's most populated state is in the grips of a COVID crisis, the Prime Minister is busy blaming premiers of other states for what might or might not happen in November. And he's doing that because if those timeframes are in jeopardy, it's because of the New South Wales outbreak, an outbreak that he's refused to take any responsibility for. That's despite his failure to get enough vaccines, his failure to deliver regional quarantine hubs, which could have avoided the New South Wales outbreak, and of course his insistence that the Premier of New South Wales delay their lockdown, which ultimately resulted in this outbreak.
They will open up even if they've still got significant case numbers. Will we open our borders to New South Wales and those Canada?
Well, that will depend on the circumstances then, the caseload, number of hospitalisations and the situation in other states. So we're not going to get ahead of ourselves. We look to see what's happening in New South Wales each and every day and adjust our posture accordingly. That's why we've got this new, strictest ever border in place right now, and why we're racing to get as many people vaccinated as we can, because we too want to achieve those thresholds. We're signed up and committed to the plan that National Cabinet endorsed, but that was a plan that was endorsed before the New South Wales outbreak.
How often do you think it is for New South Wales to open up? We saw in Israel, they got to 80% vaccination. They went from nearly 0 cases a day and now back to 6,500 cases a day. There's the issue because of the Delta variant. Do you think it's crazy to open up at 80%?
I think this discussion has been oversimplified and the Doherty modelling has been oversimplified, and it's not a case of open or locked down. Of course, there are many restrictions between fully open and locked down, and depending on the caseload, depending on the rate of spread, and depending on the rate of vaccination, well then you can choose which of those restrictions you put in place and model out with what level of restrictions you get, what level of cases and what level of hospitalisation, and that's precisely what we will be looking to over coming months. But right now we just need New South Wales to get in control of their outbreak, because everyone sees those case numbers. They're going up dramatically every day. Well, look, this is a roadmap, and we've said we've had roadmaps all along, we've had plans all along, but they are based on the circumstances at the time, and so decisions that get made will need to be based on the circumstances at the time. I've tried over the last 18 months to predict where this pandemic would go, and I've almost always been wrong, because it's been very unpredictable, and so we remain committed to the roadmap, we remain committed to the plan, but some of the facts have changed, and that is the massive outbreak in New South Wales. Well, look, as I say, there are a range of restrictions that can be applied and loosened, and we are right now in a state of quite open up in Queensland, and I know the Queenslanders I talk to want it to stay that way. I don't have that level of detail. I just had that report from our police who are on the border yesterday, and of course the number of people considered essential that would qualify for that is now very, very narrow. We've greatly narrowed the number of people eligible to cross the border. Look, I'm not aware of that, but the being permitted to cross the border when we have the strictest borders in place is a privilege, and I think anyone who expects to be able to access that privilege should be able to get vaccinated. It's not too much to ask them. Yeah, I'm not across the situation in individual towns in New South Wales, but I do know that the safety of our remote Indigenous communities has been a priority for us throughout this pandemic. We went to great lengths to keep them safe, and we've been very fortunate not to have any cases in those communities. Right now, we're racing to get as many people vaccinated in those communities as well as in our border towns as we possibly can. We already have very high rates of vaccination, particularly in Torres Strait and the Cape, but we want to see all of our Indigenous communities vaccinated, as well as our urban Indigenous communities, and I was pleased to spend some time with Deadly Choices this week to support their efforts to see First Nations people in Queensland vaccinated. Well, the test, I'll go to the Deputy Cho on the specifics, but the test here is whether Queensland, whether there is anyone else in Queensland who can do that job, whether we need you here, and where that has been assessed by the Directors General of the relevant department, so where it has been assessed that the workforce currently in Queensland can deliver those services, then those workers have been deemed non-essential. Sure. Well, look, I understand there was a protest yesterday. We have intelligence on those protests today, and all I would say is that they are shameful and reckless. That's not the kind of behaviour Queenslanders do. It's very un-Queensland-like. We have gotten through this because Queenslanders have done the right thing. We've kept each other safe. Now, I've been to a lot of protests. I've organised a lot of protests. I love a good protest. But now is not the time for protests, particularly not on the border. The border is our riskiest place right now. We have to see the situation in New South Wales the same way as we have seen the situation in other countries throughout this pandemic. That is the rate of infection there. And by having a protest there, we make the job of our police harder. They put their own safety at risk, as well as the safety of the community. And I'm frankly pretty disgusted. Sure. Look, Harvey has lots of fantastic plans. I always love Harvey's plans, and I love talking to him about them, and we'll consider this one, the world's tallest tower. I suppose the problem with building a world's tallest tower is you only have it until someone else builds a taller one. I understand from cabinet papers released today, this was something that the Bjelke-Petersen government discussed in 1986. I'm not sure how tall theirs could have been, or whether someone would have built a taller one since then. I think one of the reasons the IOC picked Brisbane is because of our lifestyle and our natural beauty, and frankly, that's what I'd like to be projecting to the world. You know, I'd love images of Gold and Sunshine Coast beaches, Straddie and Moreton and Fraser Islands, the Great Barrier Reef. I'd love for that to be what people take away from the Olympics. And let's not forget, we're also going to get a whole heap of incredible landmarks between now and 2032. Those new train station, new inner city train stations that Mark is working on with Cross River Rail. Queen's Wharf, Brisbane is going to be an incredible landmark. Not to mention the brand new Gabba, already recognised by cricket fans around the world, soon to be recognised by sports fans around the world. Look, I'm sure education has contingency plans for all of those situations, but even at the peak of our most recent outbreak, we had very low case numbers, and that gives us the flexibility to do things that can be deemed essential. I don't, but I'm happy to get police to put out a statement with that. Of course.
Oh, no, it's a good question. Yeah, look, it is a good question, and it's a place that we're going to monitor very, very closely because Israel, my understanding is the population there is around 9 million. So, you know, comparable potentially to New South Wales. They do have a very high vaccination coverage, and they are still continuing to see a large number of cases, and I think you were quoting the numbers earlier. It's very important to keep watching what's happening there, and I think that highlights that you do need to dial up and down in terms of the restrictions that are in place, because it's not all about vaccination, even though vaccination is very important, and vaccination is the biggest tool in our shed, really. It's not that it's necessarily the case that we'll be able to dial back completely on restrictions once we hit desirable vaccination targets. That said, it is our ticket to dialing back, and the higher the vaccination coverage, the greater the improvement you'd expect to see in the amount of restrictions that get eased. Look, I don't have the specific rates for deer and bandy. That's something we could probably look up and get through to you. Yeah, look, they've done a great job at vaccinating out that way. Often what you find is in country areas with lower population numbers, you often find very good, very high levels of vaccination coverage. So southwest and central western Queensland are typically very good. Because of the smaller numbers and the commitment of the local health services to really reach everyone in the community. They have to show some documentary evidence of it, so I believe that's a vaccination record that they have to show. Well,
the Doherty research says that at 70% vaccination rate, the likelihood of requiring lockdowns is greatly reduced, and at 80%, the likelihood of requiring a lockdown is very small and that they can be very targeted. That's what the Doherty research says. Now, lots of people are verbaling the Doherty research. Lots of people are saying that at 80%, that means all restrictions are lifted. Well, nobody signed up to that plan. We signed up to a plan which said that at 70%, lockdowns would be much less likely, and at 80%, they would likely only need to be very targeted. Well, we may. It will depend on the situation here and the situation in New South Wales. Look, I'm not across those conversations. I am off to see the Broncos play the Warriors this afternoon. It's great to have so much sport happening here in Queensland right now. Of course, we'd love to host more of the finals. Frankly, I think the NRL Grand Final should always be played in Queensland. I think it's a travesty that they have signed that long-term deal with New South Wales.
All right,
Thank you. Good.
Thanks, DP.
Thank you.
Yeah.